Hello students, coming to the last gland, we have seen the parotid gland, we have seen the thyroid gland, and now coming to the submandibular gland. A slightly complicated structure, the submandibular gland. Just try to understand this. The submandibular gland is in the form of a C-shaped structure, C-shaped. Again, it's a gland. So this gland will be having a true capsule and a false capsule, right? So the true capsule would be formed by the condensation of the connective tissue around the gland. And the false capsule would be formed by the investing layer of the deep cervical fascia, which splits and encloses the gland, right? So the investing layer of deep cervical fascia was forming false capsule for two glands, students. One is the parotid, yes, very good. And the second one is the submandibular gland, whereas the pretracheal fascia was forming the false capsule for thyroid gland. Excellent, huh? Very good, very good. You answered very well. Excellent. Now, understand the submandibular gland. Have a look at this. Okay, fine. So what is this muscle here? That's the mylohyoid. You know this, the floor of the mouth. The floor of the mouth, which is that muscle? Mylohyoid. It forms the floor of the mouth. So, this gland will lie below the mylohyoid. If that's my mylohyoid, it will lie below the mylohyoid. Here, I can actually feel the gland, So like suppose if that's the mylohyoid muscle, that's the mylohyoid. I'm showing off one side, that's the mylohyoid muscle. The gland is lying below the mylohyoid. That's the skin. I can actually feel this gland. So I'll make it like this. That's my mylohyoid. The superficial part lies here. The posterior border of mylohyoid is a free border. That's a free edge. So the superficial part of the gland lies here. The gland comes back, turns around the mylohyoid. It winds around the mylohyoid and goes deep to the mylohyoid. It is like this. It is like this. It is like this. Comes here. It winds around the mylohyoid and goes to lie deep to the mylohyoid between. This is the deep part of the gland. Between the mylohyoid, and there's going to be a muscle here like this. This muscle here is going to be the hyoglossus. This you're seeing in a side view. So that's the mylohyoid muscle. That's the superficial part of the gland. The gland winds around the posterior border of mylohyoid. You can see this. The gland is going to wind around the posterior border of mylohyoid, and it comes to lie deep to the mylohyoid, above the mylohyoid, or it lies between the mylohyoid and the hyoglossus muscle. Mylohyoid and the hyoglossus muscle. So how is the shape of the glands? It's not a C-shaped. You would say it's a C-shaped. No, it's not C-shaped. Why? Because the superficial part of the gland is long. The superficial part is long and the deep part is very short. So this becomes a J-shaped gland. J-shaped. That's the submandibular gland, right? So the superficial part lies below the mylohyoid. It winds around the posterior border of the mylohyoid, and the deep part lies between the mylohyoid and the hyoglossus muscle. Look at this slide, students. Look at this slide. Okay, I'll show you another good slide. No. So that's a slide. Fine. So what is this muscle? Look at this muscle. This muscle is the mylohyoid muscle. That's the mylohyoid. What is this part of the gland? That's the superficial part of the submandibular gland. We've taken a section. This is the tongue. That is the mandible. So that's the superficial part of the submandibular gland. Now this gland will go backside. It will turn around the mylohyoid. And what is this? That's the deep part of the submandibular gland. That's the deep part of the submandibular gland lying between the mylohyoid, and this is the hyoglossus muscle. Hyoglossus. Are you able to follow this? That's the mylohyoid, that's the hyoglossus, that's the superficial part. It will go back, it will wind around the mylohyoid, and it will come to lie between the mylohyoid and the hyoglossus muscles. Okay, have a look at this slide if it's not clear. So that's the mylohyoid muscle, that's the hyoglossus muscle. Here would be the superficial part of the submandibular gland. It will go back, it will turn around the mylohyoid, and this is going to be the deep part of the submandibular gland between the mylohyoid and the hyoglossus muscle. This is the orientation that you should have. Look at this slide. So there was a muscle here which they have not drawn here. What is this muscle? This would be the mylohyoid muscle, mylohyoid. So you're looking inside the oral cavity now, inside. So this is the mylohyoid. This muscle is the hyoglossus. That's the hyoglossus. And what is this going to be? That's the deep part of the submandibular gland. That's the deep part of the submandibular gland. So the superficial part would be here, below the mylohyoid. So below the mylohyoid, it turns around the posterior border and comes inside to lie deep to the mylohyoid. Are you following this, students? Clear? Okay, so that's about the submandibular salivary gland. Understand the superficial part of the submandibular gland. The superficial part of the submandibular gland will have three surfaces. It's a triangular structure. Look at this. It's a triangular structure. So it has got three surfaces like this. Three surfaces. That's the superficial surface. That's the superficial surface. That's the lateral surface. Lateral. And this is the medial surface. Medial surface. Okay. So the lateral surface would be related to the mandible. And I told you, we've seen the facial artery. You remember facial artery in the face? The facial artery is going to wind around the submandibular gland. Look, it is going to go like this. It is going to go like this, the facial artery. The facial artery is going to form an S-shaped loop over the submandibular gland. So the lateral surface of the submandibular gland would be related to the mandible. It would be related to the facial artery. The lateral surface. We're talking about the superficial part of the gland, superficial part. You're following this? The superficial part, the lateral surface would be related to the mandible and the facial artery. The facial artery winds around the gland and then comes here on the anterior border of masseter. That's the facial artery. So lateral surface. The medial surface is related to this muscle. Students, what is this muscle? Once again, what is this muscle here? Mylohyoid. So the medial surface of the submandibular gland is related to the mylohyoid muscle. And what is this surface? The superficial surface would be covered by the skin, superficial fascia, the investing layer of the deep cervical fascia, and the platysma muscle. Platysma. So superficial surface is this, what we feel. What we feel here is the superficial surface of the submandibular gland related to the skin, superficial fascia, and the investing layer of the deep cervical fascia. The lateral surface of the gland would be related to the mandible and the facial artery. The medial surface would be related to the mylohyoid muscle and the mylohyoid vessels and nerves. Mylohyoid vessels and nerves. Are you following this? So that's the superficial part of the gland. Look at this. That's the superficial part of the gland. Now this superficial part will turn around. It will wind around the mylohyoid. It winds around the mylohyoid and it goes inside. Right, it goes inside. And what is this part? This is the deep part of the submandibular gland. This is the sublingual gland. Don't get confused. That's the sublingual gland. That's not the submandibular gland. So this is the deep part of the submandibular gland which lies between the mylohyoid and the muscle here which they have not drawn here. That would be the hyoglossus muscle. Hyoglossus. Students, I hope you've got an orientation about the submandibular gland. Right? Okay. So superficial part, deep part is clear. Where is the superficial part located? Clear. Where is the deep part located? How does it wind around? How does it become a J-shaped gland? Is this clear? You understood the capsules of the gland. Capsules, the true and the false capsule covering the gland. Now this submandibular gland will have a duct. Okay, look. This submandibular gland, like the parotid gland, the duct is known as Stenson's duct. The duct of the submandibular gland is known as Wharton's duct. Wharton's duct. And this duct opens just below. It opens in the floor of the mouth. Okay. Just on the sides of frenulum linguae. Frenulum linguae is the attachment there. Okay. By the side of frenulum linguae. So this duct is the Wharton's duct. And the submandibular duct, look, this is the deep part of the submandibular gland. That's a submandibular duct. This submandibular duct is crossed by a nerve. That's a very important MCQ, students. The submandibular duct is crossed by, it is looped by the lingual nerve. Can you see this? So that's the submandibular duct. Have a look at the slide once again. So that's the submandibular gland, deep part of the submandibular gland. That's the submandibular duct, and this submandibular duct is looped by the lingual nerve. And this is the submandibular ganglion, which is hanging from the lingual nerve. We've seen this in the ganglions, submandibular ganglion hanging from the lingual nerve. Clear, students? So that's about the submandibular gland. Now, what is the nerve supply of the submandibular gland? Nerve supply. It's the parasympathetic nervous system. It's a gland. So which is the nerve supplying the submandibular gland? We have seen this, students. We have seen this. What are you saying? Facial nerve. Excellent. The nerve supplying the submandibular gland is the facial nerve. What is the name of the nucleus of the facial nerve to supply the submandibular gland? That's the superior salivatory nucleus. That's the nucleus of the facial nerve. Superior salivatory nucleus, it's tympanic branch. We have written this already. Tympanic branch. Oh, I'm so sorry. Not, not the tympanic branch. Tympanic branch was for which nerve? Anyway, tympanic branch is for the glossopharyngeal nerve, right? So superior salivatory nucleus, the sensory branch of facial nerve. The sensory branch of facial nerve is known as the nervus intermedius or the nerve of Würzburg. Nervus intermedius or the nerve of Würzburg. Sensory branch joins with the motor branch and forms the trunk of facial nerve. Trunk of facial nerve. This trunk of facial nerve enters the internal acoustic meatus. In the internal acoustic meatus, it undergoes a bend. What is that? It enters the internal acoustic meatus. It enters into the internal ear. From the internal ear, it comes into the middle ear cavity. It undergoes a bend. What is that bend? Known as genu. Genu. And that is what we call as the geniculate ganglion. Geniculate ganglion. It's nothing to do with our ganglions. It's just a bend of facial nerve. That's the genu. We call it as geniculate ganglion. From this geniculate ganglion, we get three nerves. We've seen this: the greater petrosal nerve, the nerve to stapedius, and chorda tympani. What we are interested in now is chorda tympani. Chorda tympani. This chorda tympani comes and relays in the submandibular ganglion. The chorda tympani nerve relays in the submandibular ganglion, and from this submandibular ganglion we get postganglionic fibers which are going to supply the submandibular gland, submandibular, and the sublingual glands. Submandibular and the sublingual glands. Clear? So superior salivatory nucleus, that is located in the brain. From the brain to this ganglion, what are these preganglionic fibers and what are these postganglionic fibers? So which is a cranial nerve supplying the submandibular gland? It's the facial nerve, and that's the pathway of facial nerve to supply the submandibular gland. Superior salivatory nucleus, sensory branch, then joins with the motor branch of facial nerve, forms the trunk, enters the internal acoustic meatus, goes in the internal ear, goes in the middle ear, undergoes a bend. That's the geniculate ganglion. From there we get the chorda tympani. The chorda tympani relays in the submandibular ganglion and supplies the submandibular gland. Clear, students? So that's about the nerve supply of the submandibular gland. Fine. I hope this is clear to all of you. Look at this. This is what I was telling you. This is the loop of the facial artery. This is the loop of the facial artery. It forms an S-shaped loop over the submandibular gland. Clear, students? I hope this is clear to all of you. The relations of the gland is clear to all of you. Huh? Fine, no? The gland is J-shaped. That's the superficial part. That's the deep part. The superficial part, once again, quickly I'll tell you, the superficial part has got three surfaces. That's the lateral surface. That's the medial surface. That's the superficial surface. Lateral surface is related to the mandible and the facial artery. You can see this facial artery. The medial surface is related to the mylohyoid muscle and the mylohyoid vessels and nerves. The superficial surface is related to the skin, superficial fascia, deep fascia, that's the investing layer, and the platysma muscle. The deep part, now the superficial part winds around the hyoglossus, winds around the mylohyoid and comes to lie between the mylohyoid and the hyoglossus. That's the deep part. Then we get the submandibular duct. Where does it open? That's the Wharton's duct. I've told you that. We've seen the nerve supply of the submandibular gland. Clear, students? I hope this topic is clear to all of you. Just what is important for you is the nerve supply of the submandibular gland. So I've told you everything about it. I hope this lecture is clear to all of you. Thank you for your patient listening. Thank you. Anything else? Any other doubts that you have? You can ask me. Okay, you can ask me. So parotid gland, submandibular gland, and the third one was what? Thyroid gland. out of which the parotid gland and the submandibular gland are enclosed by the investing layer of the deep cervical fascia, whereas the thyroid gland is enclosed by the pretracheal fascia. So this investing layer of the deep cervical fascia, the pretracheal layer, and which is the third one? The prevertebral layer. Prevertebral layer was forming the floor of the posterior triangle. Remembering, these three fascias belong to the deep fascia of the neck. Deep fascia of the neck. Okay, so deep fascia of the neck is made up of three parts: investing layer, the pretracheal, and the prevertebral layer. The prevertebral layer lies in the floor of the posterior triangle. Clear, students? Thank you once again. Thank you.